Hi. If you guys want to drop in the chat where you're from so we can kind of see where everybody's joining us from tonight, that'd be nice. And feel free to turn on your cameras so that we can all see you and it feels more like a discussion than a lecture. So for the certification for tonight, since you're all joining us live, you're eligible to get a shadowing certificate. So to obtain that at the end of our session, I'm going to send a link to Google Form, and all you need to do is fill out your name, your email, and kind of how you heard about ISPR. And then we will email those certificates to you within a week. Also, if you have any questions that you missed maybe during the session, we're going to have this uploaded to our YouTube channel. And you can find the link to that in our Instagram bio. And now I'm going to introduce our speaker, Dr. Sergei Kalsow. He is a certified cosmetic and reconstructive plastic surgeon. So he's going to talk to us today about his specialization in the face, the breast, the body, and just kind of what his job entails. One of the unique things that he does is he deals with patients that are awake during their surgery, which is super interesting, and I can't wait to hear about that. And for the format today, we're just going to have, like I said, a discussion. So feel free to ask your questions in the chat and I can read them out loud. Or if you want to unmute, we can take turns doing that. But I think that's all that I have. So Dr. Kalsow, the floor is yours.
All right. How are you guys doing? Happy Friday. So yeah, if somebody has questions, ask away because I don't have a official lecture prepared, but I would like to speak and say a few things about what I do and how I became a plastic surgeon. So I'm right now 3 years into practice, so it's kind of like, relatively new. I practiced in Manhattan and it took me how many years? I don't know, I lost count, how many years to get here. It was long and painful, I'll tell you that. So first it was 4 years of medical school after undergraduate. Then it was 5 years of general surgery residency where you're a surgeon, you do all kinds of surgeries, vascular, trauma, transplant, you name it. But then you get to specialize, you get to choose your niche, what you want to go into. And I was in between vascular and plastics. And so I chose plastics ultimately. And then there was 3 years of plastic surgery residency. I finished it in Montefiore, Albert Einstein in New York. And I've been in practice for 3 years right now, private practice. I work for myself. And that's one of the reasons I became a plastic surgeon, because you could work for yourself. You don't have to answer to anyone. You're your own boss. What kind of things do I do? I do reconstructive and cosmetics. 95% of my patients do cosmetic surgery. They no insurance, they just pay me. And 5% I work for a hospital on the side, take call at night. So if somebody gets into a car accident or somebody's dog bites them, especially during quarantine, everybody's animals seem to be biting them. I go in and I repair the laceration. And for that, usually I don't get paid because a lot of people don't have insurance. So that's kind of my community service. So I kind of do both things, reconstructive and cosmetics. And let's see, you have to, practicing in New York, you have to find a niche for yourself, especially being a young plastic surgeon. Why would people go to you? Why do people go to me? Because, you just right out of school, you're young, nobody really knows how you operate. You don't have any many before and after pictures. So you have to kind of establish your own niche. So it's kind of like, it chooses you. You don't have like much of a choice of what you do. So somehow I got into this awake plastic surgery thing, and I've been doing that, and it's working out really well. I have a lot of patients that are asking for that because a lot of patients are afraid to go to sleep. And so there's some patients that are afraid to be awake. They say, oh, I don't like needles. You stick me. I could see it. I could see the blood. But so they choose to go under. And then some patients are saying, okay, I'm afraid of going to under anesthesia because I'm afraid of not waking up. So then they choose to be awake. So that's kind of my niche. And I operate, on every part of the body, from the face to the breast to the stomach itself. And that's part of the reason why I became a plastic surgeon, because you have your autonomy, work for yourself, and you get to choose whatever you want to do. As far as the surgeries, there's a lot of variety. Anybody has any questions so far?
Yes, so we have a couple coming in. The first one asks, what is it about plastic surgery do you enjoy the most, specific to your practice and specialty?
So the most two things. One is operating itself. I just like to be in the operating room. When I work with my hands, I kind of get lost. I could be there all day, just standing in front and operating. So I enjoy that a lot. And two is when I have happy patients. Most of the patients are happy. So when I see them afterwards and they tell me how they like their change and how I changed their life and how they're excited to go on vacation and all that kind of stuff, that's very rewarding. So those are two things I like the most.
Awesome. Rebecca asked, what's the longest surgery that you've ever done?
The longest. So in private practice, I think it was about 6 hours. It was after quarantine. One of my patients, she just wanted to get everything done at once. And so she wanted to do a facelift, a breast lift, a tummy tuck, a liposuction, and a brow lift, everything at once. So I kind of did it for her. And so it was like about 6 hours. Now, when I was in the hospital for reconstruction, the longest surgery there was 17 hours. And I didn't do the whole surgery myself. I was part of it. There was like 30 surgeons there. That was separation of the twins. They had the twins, conjoined twins by the head, and then we separated them. And it was done in stages. And the last surgery was about 17 hours long. It was like neurosurgeons there, plastic surgeons. So the neurosurgeons separated the brain, and we as plastic surgeons came in to reconstruct the skull. So yeah, that was one of the longest surgeries. Another surgery was about 10 hours long. It was actually it was also in the hospital. I was also part of it. I was a resident. It was a replantation of the arm. So one of our patients, so the patient was driving down the street in New York. She got into a car accident. Her hand got cut off by the window. So they took the hand into the hospital, brought it with her in an ice bucket, and then we just connected all the nerves and the arteries and tried to make it work again. That was about 10 hours. Yeah.
I can't even imagine having to do that.
Well, obviously I was part of the team. I was a resident. I wasn't, there's many doctors there, doing this kind of thing. So you're not by yourself.
Sure. Somebody asked, oh, I just lost the question. Let's see. Is there any limitation of private practice to hospital regarding surgeries and procedures?
Is there any, so you asking if I'm allowed to do everything I want in private practice? So I have to do certain things in the hospital?
I believe so.
Yeah. So yeah, that's a good question. You do everything in your private practice in my office that you think is safe. So if anything is surgery is too big, it goes over like 7 hours. You think the patient needs to stay overnight, then I do it in the hospital. But I barely do it in the hospital. I do everything in a surgery center in my office.
Makes sense. Margaret asked, what made you decide to practice in the US opposed to other parts of the world? Like, what are the pros and cons of practicing here opposed to other countries for plastic surgery?
I mean, I live right now. I live in the US. I'm actually Russian. I came from Russia when I was 9, and I've been in Florida, in the US, all over the states, Louisiana, Florida, New York, and I just decided to stay here because I think medicine is developed here, and it's a good life if you're a doctor here. I was thinking of going to Russia. I went on a few mission trips, but I just kind of live here, so I chose. It's not like I can't. If I go to a different country, I have to learn the language and I have to get certified again, so it makes it hard.
All right, it's all here. Jordan asked, what is the most difficult part of plastic surgery? Or what do you find the most difficult?
So I find the most difficult is to kind of treat patients' expectations. Sometimes you have to be like you have to guess what the patient wants. So for example, a patient says she wants a small nose, and then she means something by that, and you have to kind of imagine what she's imagining, and you have to kind of read her mind. So that's kind of like the hardest thing. And sometimes patients want something that can be done, and you have to identify those patients. So because then if you try to do something that's impossible to do, then the patient's not happy. They don't get the outcome, and it's just no point of doing the surgery. So that's the most right now the toughest thing is to identify the patients that don't have realistic expectations.
And Jasmine asked, do you use a lookbook? So like, how do you go about identifying what the patient wants? Is there like, do you have a sketch person that does that? I don't know the process for how you go along those
Well, I
lines.
mean, every patient you meet one-on-one, face-to-face, and you just ask them, what you don't like about your body. And most patients, they will tell you, for example, I have, let's say, small breasts. So, and then you say anything else you have, because if you do one surgery, you could add other surgeries to it. And then let's say if somebody wants a breast augmentation, you choose the implant sizes, and then you kind of let them try it on the samples, and then they look in the mirror and see what size it could be. And, you kind of talk to the patient and see, kind of work together to come up with a plan.
Gotcha. Going off that, Carmen asked, how do you ensure that you and your patient are on the same page with the surgery? So is that, I mean, you pretty much answered, like you go
Yeah,
through,
but that's
they
that's
try
that's the hard
on.
part. You can't ensure that. You cannot ensure
Right.
that. So when I speak to the patient, there's certain things that I look for, that I see the same thing as the patient sees. And sometimes I show a picture what it's going to look like. And then if the patient says, "Oh, that's not what I expected. That's not a good result," then you know that you're not going to be able to satisfy the patient. So and there's also some red flags that we look for. For example, if somebody's going through hard times in life, divorce, trying to get a job, and they think the surgery is going to help them in life, that's like also a red flag. You don't operate on that. In that circumstance, you kind of let the patient do their thing, recover from what they're going through, and then you operate when they're stable.
Makes sense. A question asked, what is the difference between your residency and your fellowship? So how did you choose plastic surgery, and what did those look like for you?
So, after med school, I went to 5 years of general surgery. So that's everywhere in the body you operate. And then last year, you have to choose. You have to choose either you stay in general surgery, you can repair the hernias, do things like that, or you start further training in a different field. So my options were vascular surgery, plastic surgery, transplant surgery. We do liver, kidney transplants, heart surgery when you do the bypasses, trauma surgery where you wait in the hospital until a patient comes in who was in a car accident, and you save them. You do emergent surgery like that. So those are my options. And then so I thought plastic surgery because there's a lot of variety, and there's autonomy too. You pretty much work for yourself. I don't like working for a hospital is frustrating. There's a lot of paperwork, a lot of bureaucracy, and so I kind of cut that out.
That's completely understandable. Somebody asked, what surgery do you find yourself doing most frequently?
Right now, in style is body reshaping. So what I do most frequently, I actually had 2 of those today, 3 of those today, 3 of those yesterday, is Brazilian butt lifts. So you do the liposuction, you narrow the waist, you take the fat and you inject it in the hips to kind of give an hourglass shape. So that's what people ask right now the most, especially after COVID. Everybody getting a little weight, everybody, so they want to, slim down a little bit. Some go to the gym, but some come to me.
Veronica asked, how do you approach patients who have unrealistic expectations of their surgery?
So that's a hard part because, after I meet with a patient, and if you feel like they have unrealistic expectations, I pretty much tell them in a nice way, I cannot give you the result you're looking for, so I don't want to take your money. So then a lot of times the patient says, no, doctor, I trust you. I still want you to operate on me. And then I have my secretaries kind of talk to them and really tell them that the surgery is not a good option. And then so I try not to operate on anybody who I determine has unrealistic expectations. And that is about 5% of the people I see. For example, I had a guy come in, very good looking guy, and then his face was symmetric, and then he thought one of his cheeks was lower than the other, and he wanted to fix it with a filler. So I did not see that because they were very symmetric. He kept looking in the mirror and telling me that fix this cheek, you have to make it higher. So I didn't see the same thing he saw. I just couldn't see anything. So then I couldn't help him because I don't see the same thing.
Right, and that's understandable. Somebody asked, how do you think technological advancements in AI will contribute to the practice of plastic and reconstructive surgery?
Um, that's a tough one. I don't think computers are um, AI will be anytime soon in surgery. There's right now there's augmented reality glasses that surgeons use kind of to look at the visual field, and we kind of see they help us with the angles, they help us with measurements, but it's not in practice yet. It's just theoretical. I don't even know how it would go into the surgery itself, because you need a surgeon to think. It'll be hard to learn what the surgeon learns over the years. I'm not sure, but hey, it's possible.
Right, so you don't see very much of it in your practice as of right now.
Not anytime soon. No, no, no.
Gotcha. Going back to what you were talking about earlier, somebody asked, why did you decide specializing in plastic surgery over vascular surgery? Did some instance sway you, or did you just
Mm.
find that you like plastic
Yeah, so I
better?
was in between the two a lot. I was like, debating over a few months, and I like vascular surgery because I just like operating in the vessels, putting them together, putting the veins together. You take a little stitch, you stitch them up. You kind of, it's very meticulous. It's interesting surgeries, but it was the autonomy for me. So if I was a vascular surgeon, I would have to work in the hospital. My schedule would be determined by other people. Pretty much what I do would be determined by other people, and I didn't want that. I, you know, wanted to be more autonomous.
Going off that, somebody asked, how did you balance establishing a private practice so early on in your career post-residency, aside from discovering your niche?
Um, well, I graduated 3 years ago. June 30th is when everybody graduates. All the surgeons graduate. So June 30th, I was working in a hospital. July 1st, I was sitting in an office. I had my suit on. I was ready to see patients. Nobody came to me the first day. I just came there, had my suit on and left. And then, I started to brainstorm. I said, what can I do to, how do I find patients? How do I get them? So then you think of what procedures you could do. You figure out how to do advertisements. You do it yourself, Google AdWords. I had to do all that stuff. And then slowly patients come in, and you kind of do a few procedures there. People like it, they tell their friends, and it kind of takes you to a certain direction where by itself, kind of, it's not like something you kind of choose. A little bit you choose, but not a lot.
Right, a lot of word of mouth.
Yeah.
Somebody asked, how did you set your resume and application to be competitive enough to land in plastics? So like before you landed your job, how did you get to that point?
So my academic career is like a roller coaster. Sometimes I'm the best in the class, sometimes I'm the worst in the class. So in residency in general surgery, so you could go straight out of med school. I did not have the grades in med school to go straight out of med school to plastic surgery, because you have to be top of your class in med school. Out of like 130 people, have to be like one or two. And so I went to general surgery first, but when I went to surgery, that's what I liked. I kind of got into it. So then I got the best grades in the country based on the scores there, and I was good with my hands. The other doctors recognized it. They gave me good evaluations, recommendations, and so then everything kind of fit together. So then I had the option to do whatever I want to do.
Okay, gotcha. Um, the same person also asked, how did you go about forming your practice? Do you think a master's in business or health administration is needed to learn about and start your own?
I know nothing about business. I know nothing about finance. I've been in med school all my life. So when I started my practice, I'm successful right now. I don't even, I don't know about my margins, but I don't need to worry about my margins because they're good. So I don't know nothing about business, but I don't have to, because I'm efficient in surgery. I do a lot of surgery, so that has me covered. But I have no idea how to do, even like balance sheets and things like that. So you don't need that to be successful.
Gotcha. And going off that, somebody else asked, what were your specific challenges in opening a private practice? Do you feel that you had any like obstacles that you really had to overcome, or did it mostly fall into place?
Well, yeah. So a few obstacles. I think the main ones is first to convince patients to go to you initially. Nobody wants to go to you if you don't have before and after pictures. And when you graduate, you don't have any before and after pictures. So yeah, so that's number one. Number two is to, let's say, practice where you want to practice. So I practice in the middle of Manhattan right now. But in order to practice here, I had to get privileges at a hospital, which is governed by other plastic surgeons in Manhattan. So it's like a monopoly. They don't want to let you in, and you have to somehow get in if you want to practice in Manhattan. So that's another challenge. Let's see. Also, like one of the main challenges I had, like technically with surgeries, is you by yourself. So you have all these surgeries you have to do, but you have nobody to back you up. So let's say you're doing a rhinoplasty, you change somebody's nose, but there's a spot there, you see something that you didn't expect, and you want to ask somebody a question. Like for me, I can't depend on anyone. I have to figure it out myself. So that's also a challenge. So my first year before every surgery, I had to spend like a few weeks studying for that surgery to make sure it's, everything's legit.
Wow, gotcha. Rebecca asked, what does a normal work day look like for you? How many days a week do you work, and like how many hours?
So right now, for the past half a year, I've actually been working 7 days a week. Yes, right now this is the first weekend I have off in like 2 months, and that's 7 days a week. That's kind of like, because my secretary set up a lot of surgeries and everybody wants to operate, there's a lot of patients, so I kind of want to get the surgeries done, but my hours are good. I start at 9, I finish about 4, 5. So yeah, it's I'm well rested. I have things, I do things after work. As long as I wake up on time, I'm fine.
Right. Carmen asked, what is your best advice for people who are trying to pursue medicine?
Pursue medicine. So medicine in general. So first, you have to you have to shadow first. You have to shadow, and you find a physician to shadow. Make sure you like it. But you never know if you like it or not until you start doing it. If you like science, if you like biology, those are the essentials. You're creative. So then that's the beginning. But there's no specific way to find out if you're gonna like it or not. But everybody who in my class in med school, everybody who I know that went through it, they love it and it's worth it. And there's nobody that says, "Oh, I wouldn't do it." I don't think so. When you're in med school, you have all the classes, you're studying hard. Sometimes you're a little drained, but that's part of it.
Right. I think if you really love it, you'll feel fulfilled. I have a question. Do you ever work in close contact with PAs, or do they have any impact in your line of practice?
Yes. So in the hospital, there's PAs that cover the hospital. So sometimes I don't have to drive in. They will send me pictures. They will talk to me, and I tell them what to do. And if they could do it, then they do the procedure. So, for example, last week somebody came in with a lip laceration. They wanted to call me. But the PA called me, and I told her, "Listen, this is what you do. If you're comfortable doing it, you could do it." And she did it. So that's one way. Is another association with PAs is, for example, if somebody does Botox or fillers, I train them and they can work with me to do the injections under my supervision, and then they do their own thing. They're kind of autonomous, and then if they have any questions, they ask me. And so yeah, I always work with nurses, PAs, everybody.
Awesome. Somebody asked, what were the challenges that you faced while in residency, and how did it impact your work-life balance?
Let's see. In residency, when I started residency, when I was an intern, it was like working 90, 100, seemed like 100 hours a week. So I had to be ready physically for it. And then it took me like a few months to get into it. I remember I was in Louisiana, there's an 80-hour work week, but not in Louisiana, and not in the place where I was. So I came to a little hospital, and then they met me for the team, and they said, "Well, you're the super intern." I said, "Well, that sounds kind of cool. What does that mean?" They say, "Well, you're always on call. You have to live in the hospital for the whole month." So I pretty much had to live in the hospital for the whole month. It was a lot of hours, sometimes fatigue, but it's very rewarding. You learn a lot and you kind of get used to it. Challenges, let's see. So you have to first, learn how to operate. Every time in residency, you do a surgery, then you have to do it by yourself. So, every time you do it by yourself, the first time, it's, nerve-wracking. You're not sure exactly what the next step is sometimes. So that's one of the challenges in surgery. I think that's the main two things: the learning how to operate and the workload, the hours a week you work.
Right. Somebody asked how big a problem is patients suing you for malpractice? Is that very prevalent for you?
Surprisingly, nobody sued me yet. Out of the 3 years I've been practicing, I haven't had one lawsuit, and I've probably done about already like 6,000 surgeries and probably over 1,000 procedures. And nobody sued me yet. I mean, I'm sure it's going to happen. Yeah, let's see. So a few patients asked for the money back, but I talked to them, and we kind of settled it. But nobody is really too unhappy, and most of the patients are very happy, and nobody really sued me yet.
That's good.
Now that I said it, maybe I'll get some letter next week.
Right, knock on wood. Carmen asks, do you have any tips to ensure that you're on top of your studies while in med school, and how you kind of balance your work and life?
I think in med school, the first 2 years are the hardest. So the first 2 years, you really have to be on top of things, and you have to find a good way to study. So I think the mechanism of studying is very important. You have to get a study buddy, like whatever works for you. Make business cards. I remember, everybody had different study habits, and then the people that were most successful are the ones that had the best study habits that worked for them. So, for example, when I started, me and my best friend, we always studied together, and we took turns. We read a chapter, each one of us separately, and then we took 10 minutes to quiz each other on the chapter. So that was the system we had, and it worked really well.
It's a good system. Do you do anything specific to ensure now that you have a good work-life balance?
I control my own schedule, kind of. I do. I control my own schedule. So if I'm really, really tired, I move surgeries, I cancel clinic, I could do things like that, but I don't have to do that because when I foresee things, I kind of already know like my schedule, and I don't have to, I can pace myself.
Gotcha, that's totally understandable. Somebody asked, oh, there it is. Did you shadow a plastic surgeon while you were in undergrad?
Yes, I did. I shadowed a plastic surgeon in Florida. His name was Dr. Siegel. He was an older guy, very nice guy. And I learned some things from him, and I learned how he approaches, patients, and the problems that he deals with. But I really had no clue what he does in the surgery itself.
That's fair. Somebody asked, how difficult was clinical rotations during med school?
During med school. So my structure in med school were 4 years. First 2 years was a book study. Then third year is the clinicals where we rotate, and that's the important year. Fourth year, nobody really cares about. You already matched, you're already graduating. That's like vacation time. But third year, it was difficult. The most difficult thing there was to manage and deal with the team. So then you meet personalities. You come on the floors in the hospital, you show up there, and you get to meet the attending. Some of them are mean, the residents, some of them are mean. So you have to learn how to work with a team. So I found that the most challenging part. You don't really have to study much at that point, but you have to absorb the practical information, and then there's a test at the end of every rotation. But what was most challenging for me is just working with the team, learning that aspect.
Gotcha. I would think it's a hard adjustment. Somebody asked, did you do any research in undergrad or med school?
In undergrad, I did not. I did a lot of shadowing. I did volunteering. I went to volunteer in diabetes camp. I never really did research. I took a year off before med school, and I worked in a laboratory, like a neuroscience laboratory. I was operating on rats a little bit there, studying anxiolytic medications. So I was kind of working with PhD students, but I wasn't doing research myself. In residency, I did do some retrospective studies, but never really a double-blinded control experiments, nothing like that, no. So I was always more focused on operating, getting good outcomes, patient care, as opposed to research. But I know my strengths and weaknesses. I know I'm not going to be good in research, so I don't follow that. I know I'm good with my hands, so that's what I focus on. There's some surgeons who are very good and they're better at doing research. They can, each month they can print whatever, 50 papers, but that's what they focus on. That's their focus. And they're good surgeons, but I don't do that, but I'm better than them in the operating room.
Gotcha. And we need both, so.
Yeah, true.
Somebody asked, what are your favorite hobbies / what do you do in your free time?
So free time, right now, a lot of it has to do working on my private practice. So I have to organize everything myself. So for example, right now I'm moving my office. I'm renting a 17th floor, the whole floor in the building here, in the medical building, and I have to expand. So now I hired a virtual assistant who's going to help me with like interior design. I have to figure out like what color I want things, what furniture I want. Then I have to figure out how to buy all the equipment, where to find the staff, hire the staff. So it's kind of a lot of things is dealing with my private practice, which I like. And then my hobbies, I used to play a lot of basketball, but now I don't have that opportunity. The first year, I didn't have a lot of patience. So I used to be in the gym all the time, but not anymore. And plus I have to be careful with my hands. If I hurt my hand, then that's it, I'm done.
That's true. Cresley asked, how do you handle a situation where there's a surgery mishap or complication?
So, everybody, the only surgeon that does not have complication is the surgeon that does not operate. So everybody who operates has complications. And so you have to find the best way to treat the complication. You have to realize, first realize that there's a complication. That's the number one step. A lot of times when people have bad complications is because they're missed, and it's easier said than done. There's a lot of times in surgery where something happens and you don't realize it up until a day later, and it's too late. So first is you have to see the patient yourself, ask them to come in, identify the complication. That's the number one, and then every complication has a standard way to treat it, and then you just follow the protocol. But I didn't have any complications that are out of the ordinary. So let's say certain complications are expected at a certain percentage. So for example, 100 surgeries I do, I know out of those 100 surgeries, maybe 2 patients will get an infection, right? So then I already know that's going to happen. So let's say if I do breast implants, maybe like 1 out of 1,000 gets an infection, but it happens like 10 days out. So 10 days after, you have to see the patient, let's say, to see if there's anything red, So you kind of work, in trying to anticipate the complications that can happen. And the goal is not to have complications, is to try to minimize them. So then you go back, something happened, you go back and you say, okay, what do I do? What can I do different to prevent such complications and to decrease the risk?
Gotcha. When infections or complications like that typically happen, or is that something that you resolve, or do you refer them once you see them to somebody else? So
it's in private practice. In a hospital, I would refer them, but in private practice, you have to take care of it yourself. And then if if there's something you cannot do, then you have to send them to the hospital. So for example, let's say a few months ago, like December, I went to Florida for vacation, and one of my patients had, I did a Brazilian butt lift. She had an infection. One of the spots on the hip was an abscess. So I had my friend who's a plastic surgeon. He was covering. He drained it. He treated the infection. He gave it antibiotics. And then I, thought to myself, how do I do things differently? And I changed my antibiotic regimen during the surgery. And ever since then, I haven't had an infection. So, I adjusted my technique.
You live and you learn. Somebody earlier asked,
you have to try to decrease the rate of complications. So you have to know what can cause complications. Anybody who smokes, you operate, the wound can fall apart, and then people don't tell the truth sometimes. So I have a nicotine test. Somebody says they don't smoke. I say, well, look at this. I know you smoked in the past week, and say, okay, you got me. So then you don't want to operate on the people who are high risk. Anybody who, it does not is not active physically, who's very overweight of a certain BMI level, of a certain size, you don't operate on them. You ask them to lose weight first. So there's a few things you do to decrease the complication risk.
Interesting. Somebody earlier asked, that goes on you talking about moving buildings and stuff. They said, how did you manage costs or loans in building a private practice just out of residency?
So when I finished residency, I was probably like maybe like 50,000 in debt. And I had first year, I was not making too much money. I think I only had like 10,000 in my bank account by the end of the month, and they had paid my bills and I had 5,000 left. So then the first few months, it was kind of like this, but then slowly it picked up. And now I think now I make more a month than I did probably all my years in residency. So 8 years in residency, I probably make more than a month more than that.
Gotcha. Somebody asked earlier, what are your thoughts on the recent change made to the PA title by the AAPA?
Physician associate versus physician assistant, I think is great. Yeah, I think it's great because physician associates, they do their own training, they practice with a physician, but they're not, assistants. They don't assist them, they practice independently.
Right. Somebody asked, did you take loans for student loans and how difficult was it to pay off?
I took, yes, I took some loans. My parents helped me a little bit. So I think when I started my residency, I was maybe 150,000 in debt. And then during my residency, when I started paying off my loans right away. It was like a 10-year plan. I found that the easiest way to pay back. Anything longer, you get more interest. So I kind of had systematic payments, and by the time I finished, I was only like 50,000 in debt. And then I paid it off pretty fast in the first few years.
Gotcha. And you don't have to answer, but somebody asked, starting out, how much can a plastic surgeon expect yearly salary-wise?
Starting out,
Yes.
well, starting out, the first, if you work for a hospital, you have a position set. So I think maybe you make 300, 400,000 a year in the United States. And that's the first year, and then it kind of slowly increases to maybe about 500,000-600,000. And in private practice, you start out, you make barely anything. Like my first year, I don't know how much I make, but it wasn't anything. And then it kind of picks up faster, much faster. Well, it depends on how you handle it, how you develop your practice.
Right. Somebody asked, is it harder to do a procedure on someone getting implants for the first time or fixing someone who's botched, saying that you only have to fix the mistakes and not start over?
It depends if whenever it's botched, if there's a way to fix it. So sometimes if it's botched, there's no way to fix it. There's no good way to fix it. And sometimes you could see that something that you do will change it, will make it better. So it depends on what the situation is. But first is always easier usually. So nobody had surgery before, you don't know nose or no implants. If you go in there, there's no scars, everything's clear, the anatomy is clear. So it's usually easier the first time.
That makes sense. Megan asked, who or what was your biggest inspiration to get into this field?
Well, probably my dad. I always was inspired by my dad. He's a dentist. He's not a surgeon. He's a dentist, but he always, told me to work with my hands. I kind of saw him. I went to his work a lot when I was younger, and saw how he treated patients, how he was professional, how he did things, and he was kind of always my inspiration.
That's awesome. These two questions kind of go together. One person asked, do you ever watch the show Botched? And then somebody else said, do you have time to watch TV shows or movies during the week, and how often?
Yeah, I've never seen the show Botched, maybe like episodes of, like maybe like clips of it on the internet somewhere, and I never seen really TV shows about doctors. I never had time. I had my TV, I was watching it during COVID. I had some free time, but it's been in the closet ever since. I don't have time to watch it.
Yeah, things are picking back up. how did COVID affect your practice? Did it really change how you did, or did it slow everything down?
So COVID in New York, we were shut down completely. So about a year ago, they said, listen, all the elective surgeries have to shut down. So I still had my bills to pay because I had rent to pay and my office rent, but I couldn't operate. I couldn't bring the money in. So I just took that time to, relax a little bit, and I went to volunteer in the hospital, and they put me in ICU there. So I was kind of managing ventilators, something I haven't done in a while, but it was interesting.
It's nice that you got to kind of branch out or go back.
Yeah, it was fun. It was a good time. I did some procedures I haven't done in a while, like central lines, chest tubes, all kinds of things.
That's nice. Yeah, someone asked, if you go back in time, what would you change in your major path?
In my
If
major
anything.
path, I would really, I wouldn't change the path, but I would enjoy the process more, knowing that you have to enjoy it. You can't always like wait for something to finish. So I would enjoy my first year of medical school more, first year of residency more, just kind of enjoy the process more, but I wouldn't really change much. Maybe I would study more sometimes, but yeah, not necessarily. I think I had a good work-life balance ultimately. So I would maybe, I wouldn't change much.
Awesome. We are nearing like 45 minutes. I don't know if you want to just take a couple more questions and then we can wrap
Yeah, let's
up.
take a 5-10 minutes worth of questions.
Okay, awesome. Let me see. I think I missed a couple back here. You guys have had great questions. Oh, there's one.
Knicks and Nets. Haven't been watching, but I think Nets are good right now. They have the three good players. Kyrie Irving. Who else is there now? The guy from Houston Rockets with the beard, and somebody else. So I think they're Kevin Durant. So I think those are the three players there right now that I think they'll do well. I don't think Knicks have a good team right now, but I'm not sure. I haven't been watching.
Somebody asked, what material did you use to study for your MCAT?
For the MCAT, I took the Kaplan course. I think at that time it was the best course I thought, but that was like 15 a while back.
Right. Somebody asked, what's the hardest part of being a plastic surgeon? So I think you touched on that a little bit, but
yeah, I mean the hardest part is dealing with patients who are unhappy. If you operate on somebody that are not happy, you have to talk to them about it, and you have to keep talking to them about it and try to make things right, and that's the hardest part.
Somebody earlier asked, how do you set costs for cosmetic plastic surgery? So is that where you kind of look
Honestly,
at what other offices are doing?
I kind of go in the room and I talk to the patient and I see how complicated the process would be, and I come up with the price right there. But it's usually in a relative range.
Gotcha. Somebody asked, what part do you most look forward to when going to work?
Probably operating itself. I love to operate. You have to do what you like to do, and I focus on what I like to do the most out of all the medical school residency. The part that I like the most is being in an operating room, and that's what I spend my time doing 100% right now. Almost like in the past few weeks, I've only had like one day of clinic, and in the past month, I did 70. I just counted with my secretaries. In the past month, I did 76 surgeries. So yeah, I like to do it. That's what I do.
That's cool. Danielle asked, do people often come back to get a procedure changed or modified?
After you already operated on them? Sometimes. So the times where I had people come back and ask for more, they would ask, let's say, for maybe like you put breast implants in, they would want a bigger breasts. You make a nose, they want a nose a little bit smaller. They come back, they like the result, but they want a little bit more. You do the liposuction, the waist, they want to narrow it a little more. So yeah, maybe like 15% come back and want a little more.
Gotcha. Somebody asked, how's living in Manhattan as a plastic surgeon? Do you love it? And why did you move to NYC to live in practice?
Well, Yeah, I love it. Manhattan's great. It's very convenient. I work 3 blocks away from where I live. I live on the Upper East Side, um, and I love it. There's plenty of things to do. It's like a big playground. You do whatever you want. And but yeah, it's really great. It's great to live in Manhattan. And I moved here because when I'm originally I'm from Russia. I used to live in New York back in the day, so I had a lot of friends. So I went to Florida and I came back up here to kind of hang out with my friends at first, and then I stayed.
That's awesome.
But once you start a practice in a certain place, you have to stay there kind of. So for example, in New York, I have my practice, but if I was to move to Florida, a different state, I would almost have to start anew again.
Allison asked, what are a couple of traits about you that drove you to like performing surgery? So what kind of strengths, I guess, might help you, and what do you think lent you to like surgery more?
I think strength for a surgeon, number one, is to be persistent. You have to be persistent in everything. You have to be persistent to keep learning how to operate. You just have to kind of put your head down and just keep doing that. Keep doing the things you want to do. You want to learn. That's the number one quality, just resilience and persistence for the surgeon. Other specialties have different qualities, but for a surgeon, I think persistence is the key.
Gotcha. Did you go into med school thinking you wanted to do surgery, or did that come after you did your rotations?
Yeah, I kind of knew that I wanted to be a surgeon when I went to med school. Before med school, I always kind of worked with my hands, made things, and I kind of knew it. I didn't know what type of surgeon specifically, but I knew I wanted to do something surgical related.
Gotcha. Somebody asked, do you ever burn out from having to concentrate for 6 to 7+ hours straight in a surgery?
Not necessarily. I don't know. When I operate, you just kind of focus. You don't really have to. You don't get tired for some reason. I don't know. So maybe that's the adrenaline. You don't have to go to the bathroom. You get tired. I don't know. You're just there. But after the surgery, sometimes when I sit down at the end of the day, yeah, it's a little tiring, but it's good tiring. It's you feel like you accomplished something, and now you get to relax.
Gotcha. Somebody said during a long surgery, do you ever take breaks or switch with another surgeon?
I don't right now. No, I just keep going. Maybe when I get older, I have to take bathroom breaks or something, but not yet.
All right. Chrisley asked, did you ever doubt yourself during your undergrad? If so, how did you combat it?
During the undergrad, yes, of course. I mean, everybody doubts themselves, I think. During the undergrad, so in high school, I didn't have good grades. When I was a freshman in college, I pretty much locked myself in. I knew I had to take the core science classes and do well. And it was hard to kind of get good grades in them. And then you go in there. There's a curve. Everybody's smart. You talk to your friend who's like, you think like he knows everything and you don't, and you always doubt yourself. Yeah, but then you just have to be, like I said, persistent. You just have to do it stable, keep going, improve a little bit, keep learning, and then you'll get there. It's consistency and persistence, I think.
Awesome. When somebody asked, when did you decide to pursue medicine? Was it since you were a kid, or did you decide in college?
I think before college sometime, because I have in my family, I have my grandmother was an ENT doctor. My other grandma was a nurse. My dad was a dentist. So I kind of had people in my family in medicine. So that's where I was already leaning towards that. But that was before sometime when I was maybe like 12 or 13.
That's awesome. While you guys are sending in your last few questions, I'm going to send the link to the Google form, just in case anybody has to leave early. But keep sending your questions if you have any. But I wanted to go ahead and send that in.
That form is to get credits. Could I fill it out too?
Yeah. We'll send you a shadowing certificate to say that you were here.
I would like that. So. Yeah. In case I want to go back and do it over again.
Exactly. Fatima asked, how do you balance your family life with your career?
Well, right now I'm not married, so that's not too hard to do because I'm not married. But my colleagues who are, it's a little harder. You come home, there's kids, and it's. But some people, I think, they go to work more when there's family at home. I don't know why, just to escape sometimes. But yeah.
That's fair. Do you see a lot of, like with age, a lot of plastic surgeons, like how do I ask this? Is there an age where a lot of plastic surgeons retire? Like, is it younger than most professions because you have to be really steady and stuff with your hands? Or is there not one?
Well, I think there's an optimal age for performance, like in all fields. Like for example, in athletes, if you play basketball, you kind of reach your peak at 30, and then you kind of slowly descend. By the time you're 40, you're already retired. For surgeons, for plastic surgeons, I think it's you reach your peak when you're maybe like 45, 50, and then you practice up until you're about like 65, 70, and then you kind of you don't retire, but you have to narrow your scope of practice. So you have to do only a few surgeries that you do the most of, and you kind of limit yourself to what you do. And then you could practice longer. I know some surgeons that practice until they're 95. Yeah.
Somebody had asked this earlier. I think they had directly asked it to me, but do you ever recommend, like if somebody comes in, do you recommend not getting a surgery because of their age? Like if they're too young or too old, or do you talk about that just based on their health and stuff?
Yes, a lot of times. For example, I had a patient who I think she was 15. She came in with her parents because she wanted slimmer cheeks. This was last month, and then she wanted to remove her buccal fat pads, which is little fat in the cheeks. But she's only 15. She doesn't make her own decisions. She said, "I want to do it." Her parents said, "You're crazy," but they have to sign for her, and I don't want to do it because she's too young, I thought. And so I told her to come back later, and she said, "The first day I turn 18, I'll be back." So and then somebody, if somebody's older, if they have medical problems. I had a patient who was 81. She wanted a Brazilian butt lift. I said, I can't probably do that. You little, you have high blood pressure, diabetes. You're not a good candidate. As I said,
Gotcha. Somebody asked, are there many women plastic surgeons from your perspective?
Yes, I think it's in my class for general surgery, there was more men than women. More women than men in my general surgery group. And in plastics, I think it was 50-50. I think there's a lot of female doctors, yeah.
Awesome.
Female plastic surgeons specifically, mostly reconstruction of the breasts. Some specialties are, male dominated, some female dominated. So reconstruction of the breasts, breast cancer, I think mostly female plastic surgeons work there. And then something like trauma reconstruction, that's mostly males.
Gotcha. It's interesting. Does anybody have any last questions? And are you okay to wrap up in about 5 minutes?
Yeah, sure.
Okay. That way we can keep it at about an hour. That sounds good. I can go ahead and send the link again. Fill that out. Oh, somebody said, how do your patients find you? How much marketing or ads do you do / run?
Initially, mostly my Google AdWords I used, Instagram. Lately, I turned most of my marketing off because it's mostly not word of mouth. I operate in somebody, and I think 70% is the friends, family. They see them and they want the same surgery. So now it's much easier, but it takes a few years to get there.
Right.
And you have to give good results. It doesn't just come because you could operate in somebody and the family sees them and said, "What is this? I don't want the same surgery." So you have to provide the good results.
Gotcha. Any other questions? How difficult is the position of chief resident and what are some of the responsibilities?
So chief resident has two meanings for surgery. Anybody who's like a fifth year is a chief resident, and that's usually easier because you have everybody under you working, the mid-levels, the interns. They kind of help you out with most of the tasks. There's another administrative chief resident. That's the one that makes the schedule for everybody. That's a position that's a little harder because you have to keep everybody's interests in mind, and people get upset about the call they have to take, all that kind of stuff. So that's a little harder, but it's not it's not any different than not being a chief. But when you're a chief year in general surgery, for example, that's probably the easiest year because you're in charge. You get to delegate the tasks to the interns.
Right. This is interesting. Somebody asked, oh, were you about to say something else? They asked, would you say that you're successful by your own definition of success, or is there anything else that you're planning to pursue/do?
Well, I mean, I think I'm somewhat successful, but there's a lot of room for improvement. I have to improve, obviously, all my surgical techniques. That's constantly to be improved. Then I have to just expand in other areas. For example, I want maybe to have a teaching position on the side, go there, to a hospital a few days a week, teach residents how to operate. And so build my resume in other ways, maybe even do research one day. Just a little bit. There's a lot of goals that I still have to reach.
Awesome. I think if anybody else does not have any other last minute questions, I will start wrapping up, but feel free to interject. I just want to say thank you again, Dr. Kalsow, for joining us today. It's been amazing hearing from you.